Hey family, how you doing today? Yours truly, Sam Sylk here, man, and we have some information that we need to share. Very important information. We talked about cancer, man, prevalence in Black Americans. Big ups to University Hospitals doing so much. They're on the front line to help save lives and to give us valuable information. And joining me today is Dr. Gregory Hall, internal medicine physician, medical director of the Cultural Center for Men at University Hospitals. How you doing, Doc?
I'm good. I'm doing great. How are you feeling?
Man, I'm feeling all right. Feeling all right, Doc. Yeah,
Good.
yeah, man. And thank you for your time and I know you're very busy, man. And you have some information you want to share about these cancer screenings, man. They are so important. This can help find cancer early when it's easier to treat. So we kind of want to talk about that. Some people, you know, may have questions and things and whatnot they need to know. So let's dive into it, Doc.
Yeah. Well, what's important about cancer is to find it early, like just
Yeah.
exactly what you said. I mean, there's people. I grew up in Cleveland. My father, mother, my parents were, black, and that attitude goes generationally. My father always said, "If there's something wrong with me, I don't want to know." Right?
Yeah, right.
I don't. He didn't want to know if I have cancer. Don't tell me. And that attitude is a dysfunctional attitude, right? It's
Yeah.
if you have cancer, you want to know early, because if it's early, it can be treated, it can be removed, and you can keep on moving, right? And so it's really important that we kind of change our mindset. That we don't want to know what's wrong with us. We actually do want to know what's wrong with us, and we want to know as early as possible. I was thinking as I was getting ready for this, spring is in the air, and you
Hmm.
see dandelions. If you see one dandelion in your front yard, please go pluck it. That
Right,
one
right,
dandelion. Because if
right.
you don't, in a month, you're going to have a menagerie of
Yeah,
dandelions in your front yard. So it's not exactly the same, but it's if you can get one little tumor out of there before it starts to seed other areas of your body, you can really be much better off. So is that if there's one thing to remember from this interview, you do want to know, because you do want to catch it, because literally as we get older, our risk for cancer goes up.
yeah.
So if you live long enough, you're going to get some type of cancer. And if you get it, you want to find it early.
And so, Doc, let's talk about that on some of these preventative screenings. And what age should some people get them? So let's kind of talk about that.
Yeah. So, okay, for African American men like you and I, our risk for prostate cancer is way higher than anyone else, any other
Mhm.
group. So we want to start getting our screening for prostate cancer started at age 40. And that's with a blood test called the PSA, prostate specific antigen. And everyone should know their own PSA. It should be less than 4 and really should be less than 2 for most of your life. And so
Mhm.
every year you get that blood drawn, you find out what your PSA is, and that starts at 40. And that's critically important. And then sometimes there are some doctors that won't check that in in a patient. And so you want to make sure that you almost say, yeah, I want to check that, because the recommendation is
Yeah.
talk to your patient and ask if they want to be checked. And again, if you're like my father, if they ask him, you want to be checked for prostate cancer, his answer would be no. No, I don't check me.
I'll check me.
Right,
Yeah.
don't check me. But it's a blood test, right? It's not, I
Yeah.
don't have to do the rectal exam like we used to do in the old days, which no one wanted to have that done, and I didn't want
Right.
to do it, right? But now it's a blood test. You can get that blood test done, because if we can find prostate cancer early, we can also cure that as well. So that's age 40. For colon cancer, which is a colonoscopy, or they've got Cologuard, they got all kinds of ways they can check for that. That starts at age 45 for African Americans. It's been that for 20 years. So it was 50 for white people for the last 20 years, but they just lowered it to 45. But it's been 45. But if you ask a doctor, when should African Americans be screened, they would probably just say 50, right? But it's really been 45, because we have such a higher risk for colon cancer. And that's when you
And
go in.
you're saying now that it's 40
It's
for African
45.
American.
It's
Okay.
45
40.
now, but it
Okay.
was 50, but now it's 45. And so if you can find a polyp, which is like a little mushroom on the inside of your colon, and they can remove that during the colonoscopy, then that doesn't grow into cancer. And so
Mhm.
the treatment can screen for it, but it can also treat it at the same time. And I had my colonoscopy, nothing to get excited about. It wasn't painful at all. I actually don't remember it all. I slept through the entire thing. The prep wasn't bad. You need to get cleaned out. Some people, when people complain about the prep, it's because they need to get cleaned out.
Right.
They need to get cleaned out. There's no two ways about it. So that just started at age 45. That's colon cancer. For breast cancer, which is the classic health disparity, because white women get a higher rate of breast cancer. They have a higher rate of breast cancer than Black women. But Black women have a much higher mortality. So Black women get breast cancer less, but when they get it, they have much higher risk for dying from it. So again, you want to start screening that at age 40 aggressively every year. And certainly if you have any breast cancer in the family, your risk is higher. Same thing goes with colon cancer and prostate cancer. If you've got, your father or someone got colon cancer in their 30s or 40s, may want to get screened even before 45. You want to be more proactive about it. That type of thing could run in the family. The last one is lung cancer, a little bit more complicated because you have to have a smoking history. So if you have a 25 pack year smoking history, which means you smoked a pack a day for 25 years, you say, wow, but there's a whole lot of people who smoke a pack a day for 25 years. You know what I'm saying? Or if you smoke 2 packs a day for half the amount of time, right? Or half a pack for twice as many, then you should get screened with a CT scan for lung cancer. And we've been finding very early lung cancer and taking it out, and people are doing outstanding. So when I started in practice 30 years ago, if you got lung cancer, it was like a death sentence. Now we find it early. They take that part out and they keep on going. It's no problem at all. So,
and that's the thing, Doc, with technology and the studies that you guys, that you guys do. Again, early, and the survival is. You can correct me.
Outstanding.
Yeah.
Yeah, it's outstanding. There's the thing that they're doing, and what you think, what you think is probably wrong. Because what I know from 30 years ago, when I was in a class and learned, all that stuff's outdated. All that stuff's outdated. Wow. It's just amazing. And so things that they're doing to address cancer, to screen cancer, because we concentrated on treating cancer. Now we're shifting. Forget about treating it. Let's prevent it. Right. Let's find it early and take it out rather than really spend all of our energy trying to treat. But they have outstanding treatments, for cancer as well. So it's whatever you think. It's like when someone says, "I don't want chemotherapy." That's a very broad statement because there's so many different chemotherapies. They don't all make you lose your hair. They don't all have side effects. They don't. So just you want to find out I don't want this particular one that's going to do this or that. It's going to make me nauseous or whatever. But you don't ever make a broad statement, I don't want chemotherapy, because you don't know what kind of chemotherapy they may offer. And some of them are very well tolerated and work very well.
Yeah. What about any vaccinations when it comes to,
Yeah, well, the vaccination, the classic one is really hepatitis B, because hepatitis B led to liver cancer, which is not that prevalent. Liver cancer is not that prevalent, but because people get hepatitis B and then they would get liver cancer. So in the past, you might have heard your great aunt got liver cancer, probably because she had hepatitis B. But now, since my kids were born and they're in their late 20s, you get your first hepatitis B vaccine when you're in the hospital when you got delivered, right? And then you went back a month later and got another one. And so most people, young adults, have already been vaccinated against hepatitis B.
Okay.
And that prevents them from having liver cancer.
Okay.
The same thing is also true with human papillomavirus, the HPV. The next generation is going to have very little cervical cancer because that HPV vaccine that they originally gave little girls, now they're giving girls and boys, is preventing cervical cancer, papillomavirus, which of course no one wants, right? Yeah. And so those vaccinations can prevent cancer, right? And so it's important to say, I don't want vaccinations. Well, that's also a broad statement. You can say, maybe I don't want, but the COVID vaccination turned out good, as well. You know what I mean? In terms of we got past all this because of the COVID vaccination, right? And so it's you don't want to make a broad statement about vaccinations, but vaccinations can prevent cancer.
Yeah. Wow. And let's talk about on the when it comes to other tips we can, that can help us stay healthy here.
Yeah. Well, I mean, the exercise, the best thing you can do is nutrition and exercise, right? Making sure you have a good meal that includes fruits and vegetables, and being able to get up and do some things, because your diet, can really increase your risk for cancer, right? There's, processed meat, salami, bologna, lunch meat increase your risk for gastric cancer. And so people don't frequently know that. Just processed smoked meat, things like that. You can have it every now and then, but
meat too, huh?
yeah,
Really?
the smoked cured, that stuff has things in it that can increase your risk for cancer. So but we as humans, there's no question, we as humans were meant to be vegetarians. We're meant to live off the land, what grew out of the land, right? And then every now and then we'd luck up and kill a deer and we'd eat some meat, right? But on a daily basis, humans ate vegetables and fruits and vegetables. That's what made us to do. And then every now and then we'd eat meat. And so I see people now that eat meat, and starch, and every now and then eat vegetables, right?
I have to have vegetables every day. Yeah, right. We all do, but I have to have
vegetables every day, and you know that when you're young, you don't, you may not do it. When I was young, I'd eat a pizza and keep it moving, whatever, if there was onions or green peppers on it, that was my vegetable,
You say,
I can't do that now, right? You can't do that now. You got to have a salad, and I tell, if we order pizza, I say, give me a side salad. Do I really, truly want a side salad? No. But I know I should eat one, because if I don't, I'm going to be constipated. I'm going to decrease, it's just not healthy, right? We're humans and things. We're supposed to drink water. We're supposed to move, right? We're supposed to walk and exercise. We're not supposed to be sitting around all day.
Doc, is it still, what did they used to say, 8 glasses of water a day?
Well, it depends on how much, but you want to make sure you're adequately hydrated, right? If you're thirsty, and you should be drinking water. We shouldn't be drinking sugary sweetened beverages. You should drink water. If you want to drink ice water, you can do that. But we got to get away with a lot of calories, a lot of empty calories in those sugary sweetened beverages. Pop and Kool-Aid and stuff like that. And that stuff is what increases our stomach swelling. That's what makes our stomachs, the fat kind of gather there disproportionately, particularly in African Americans, that we tend to store our fat in our stomach. And that tends to come from fructose sources, which are in a lot of beverages. You see that high fructose corn syrup or stuff like that.
Right.
That disproportionately goes to your stomach. So if you're thirsty, drink some water. If you want to enjoy a soda or pop or something, enjoy one, but don't drink it. Don't drink
it. Diet? I've heard. What about diet soda or stuff like that?
Well, diet soda has no sugar in it, and so there's a recent study that showed that it's not as bad for you as some people thought. Some people thought at one point that if you drank diet, you still gain weight like if you drank regular, but that's not. That they did a big study on that and said that's not really true. You don't really get the extra calories with that, But it's just that people who with a big diet Coke is going to have a huge meal. You know what I mean? And then drink a Diet Coke with them, or so it's like that. And then have dessert, right? So you want to, if you have to drink diet, you can drink it. But people always say, well, what's a natural? What can I do natural, doctor? When I'm about to prescribe something, what do you got to do natural? Well, water's natural, right? Coke is not natural, right? It's just not. And I like a good Coke every now and then, but it's not, water. You can enjoy a Coke, but that's not what you drink. Because again, when we were put on the earth, they didn't throw Coke in the corner by the woods. You know what I mean?
Right.
Water. That's what we have to do. And your body has to make your Coke into water. And that's extra work for your body. So why not just give it what it needs, which is water?
Yeah, Doc, I appreciate this great information, man. Great information to share. Again, as we recap, once a year, especially for men, once a year, you should get your prostate. You gotta get that done. So
absolutely, 40 every year, and you should know it. Don't put your life into someone else's hands. Even a doctor like me, you need to micromanage your own life. Know what your PSA is. Have a primary care doctor. So the Cutler Center for Men at University Hospital is making sure everyone who signs up has a primary care doctor, because that's the person that knows you. They know what you look like. They know when you're healthy. They know when you're not healthy. I don't have to do a lot of questions. When I know my patients come in, I say, oh my God, that person's sick. You know, because I
Yeah.
know what they look like, right? I
Right,
know what
right.
their family looks like. I have multi-generations of it. So that really helps. And there's a lot of people that get their care in the ER, in the emergency room, or in the urgent care. It's not good. It's not meant for that. You know, the ER was meant for true emergencies. You know, something, I just got
Right.
shot. I'm having a heart attack. I had a stroke. But beyond that, sinus infection, diarrhea, cough, all that stuff is primary care stuff, high blood pressure. And they're not checking the PSA in the ER. No one's screening you for prostate cancer in the ER. So you could say, I've been in the ER twice a year for the last 10 years. And they're not screening you for anything. They're not checking your cholesterol to see what it is, to see if you have a risk for a heart attack. So get a primary care doctor and go and see them on an annual basis and let them screen you. So if there's anything wrong, you can be proactive about it and not reactive, and then it's a big disaster because we ignored it for most of your life.
Yeah, yeah. And I like the fact of being able to have a relationship. Uh, you have your doctor one on one. You know what I mean?
Absolutely, absolutely. Everyone wants that. And you know what? I tried to find a dentist. I went to 3 different dentists till I found a dentist I liked. And
Yeah.
there was nothing wrong with those 3 prior dentists. It's just we just weren't vibing. You know what I'm
Yeah.
saying? But it was really, because if I had to write down what was wrong with, Dr. Jones,
Right.
there was really nothing wrong with him. I just wasn't feeling him. And everyone else has that. You should do that with your primary care doctor. If you're not feeling them, if they're not communicating with you the way you want, and they're not responding the way you want, you keep looking until you find one that
I
does.
don't know you want. Right.
Absolutely, because we're here, right? My
Right.
office is in Richmond Heights. If you want to come see me, I'm still accepting patients. There are doctors all across University Hospital where you can find a good primary care doctor to listen, the one you want. Some people want a black doctor. So there's nothing wrong with that. If that's what you need, if that's what you feel like you want, get that. If you feel like some women just want a women doctor, and there's some women that just want a man doctor. I mean, whatever your particulars are, go with it, because this is very important. It's your life, and you want to be able to communicate with them and let them know whatever it is wrong with you, whatever you're thinking, and kind of benefit from what they can tell you.
Right. Dr. Gregory Hall, we appreciate you, man. Thank you so much for the time and this great conversation.
Thanks, Sam. Appreciate having me.
All right, guys. Make sure you share this video. Again, big ups to University Hospital, also Color Center for Men at University Hospitals. Thanks again, Doc.
Thank you. Take care.
All right now.